cleidocranial dysplasia. It is also called as cleidocranial dysostosis, Mary and Sainton disease, and cleidocranial dysostosis. So cleidocranial dysplasia or craniocleidodysostosis. So etiology, hereditary, it appears as a true dominant Mendelian characteristics. In hereditary, it appears as a true dominant Mendelian characteristics. In genetic, incomplete penetration of genetic trait. So there is a defect in the CBFA1 gene chromosome. So cleidocranial dysplasia, defect in CBFA1 gene chromosome. Next, moving on to clinical features. Sex, the disease affects men and women with equal frequency. And sight, it primarily affects the skull, clavicle and dentition. So the three important affected sites are skull, clavicle and dentition. The first one is shoulder. The shoulder meet in midline. Normally it would be meet in midline. Here cleidocranial dysplasia patient can move their shoulder because there is a complete absence of clavicle and patients have unusual mobility. So they can bring their shoulder forward until they meet in midline. And head, the head is brachycephalic because reduced anteroposterior dimension, but there is increased skull width. So brachycephalic, it is wide and short. And skull, there is a fontanelle often remain open. So fontanelles are open and skull sutures are open and multiple wormian bones are present. So there is occasional stunting of the long bones. And next feature is lacrimal and zygomatic bone. These bones are underdeveloped. Lacrimal and zygomatic bones are underdeveloped. Sagittal suture, it is very sunken and skull is flat in appearance. And nose, the nasal bridge is depressed with a broad base. Next, moving on to oral manifestation. First one is micrognathia, that is small jaw. So here maxilla and paranasal sinuses are underdeveloped. So these produce maxillary micrognathia. And maxilla is underdeveloped. So and is smaller than normal in relation to mandible. So maxilla is underdeveloped. So mandible is in normal because it produces, that's why it produces prognathism, because of the maxilla is small and mandible is usually in normal size. And teeth, there is a prolonged retention of primary dentition and delayed eruption of permanent dentition. And there is a numerous unerupted teeth are present inside the bone. And palate, there is a high narrow arched palate and cleft palate may be common in this patient. And hypoplasia of the enamel, the crown may be pitted. As a result of the enamel hypoplasia, the crown may be pitted. So in palate, there is high narrow arched palate and cleft palate may be seen. And radiographic features, first one is skull finding. The skull film reveals open suture. So there is a presence of wormian bones, widened cranium, delayed ossification of fontanelle, and frontal and occipital bossing and basilar invagination. So these are the skull finding. Open sutures, presence of wormian bones, fontanelle, delayed ossification of fontanelle, frontal and occipital bossing, there is basilar invagination. The next radiographic feature is chest examination. The chest examination reveals there is a malformation and absence of clavicles. So here the first picture showing there is presence of the first picture showing the normal X-ray, chest X-ray. There is a presence of clavicle, and the second picture there is a complete absence of clavicle bone. That's why the patient move their shoulder in midline. So patient can bring their shoulder forward so they can meet in midline. And the next radiographic feature is teeth. There is a prolonged retention of primary teeth and delayed eruption of permanent dentition. There is a numerous unerupted teeth are present, and there is a lot of supernumerary teeth are present, especially in the anterior region. So these OPG shows there is a lot of numerous supernumerary teeth and unerupted teeth present in the anterior region. Next, moving on to jaws. The small underdeveloped jaw and flattened mandibular angle and overgrowth of cranial base anteroposteriorly. There is a pointed coronoid process. So jaws, there is small underdeveloped jaw, flattened mandibular angle, overgrowth of cranial base anteroposteriorly and pointed coronoid process. And roots, the root of the teeth are often somewhat shorter and thinner than the normal. And the diagnosis here, the first one is clinical diagnosis. Meeting shoulder in the midline is a typical feature of cleidocranial dysostosis. This child showing the sign of meeting shoulder in the midline. So she is having a cleidocranial dysostosis. It is a typical feature of cleidocranial dysostosis. It is a clinical diagnosis. And next, moving on to the radiological diagnosis. There is a presence of supernumerary teeth. There is open sutures and absence of clavicle are present in the cleidocranial dysostosis. So the first picture showing there is absence of clavicle, and the second picture showing there is a numerous supernumerary teeth and unerupted teeth present in the anterior region, and their roots are very short and thinner than the normal. Next, moving on to the management of skull and clavicle anomalies. There is no treatment required for this anomaly. Patient can live his normal life. And dental care, as the patient may be having supernumerary teeth, they should be extracted. And we have to prosthetic replacement for the teeth should be carried out. And unerupted teeth should be extruded orthodontically. So dental care is need for this patient.